Hi everyone, thanks for joining us for our Burnout workshop. My name's Lynne Rebecca, I'm a CBT therapist, and I'm joined by my colleague Rebecca Green today. We work for the Cheshire and Merseyside Resilience Hub. So we were set up during the COVID-19 pandemic to support NHS, social care and emergency service staff. Today we're going to think about burnout. We'll focus on what is burnout and look at the components, the theory and the model of burnout. We'll then move on to burnout in the workplace, considering the impact of overcommitment and culture. And then we'll finish with some strategies to help prevent and manage the symptoms of burnout. So what is burnout? Burnout is something that we start to hear a little bit more about. Burnout is characterised by exhaustion, feeling really depleted and extremely fatigued. People notice that their attitude towards work becomes increasingly negative, they feel more pessimistic and cynical. People often report feeling ineffective and unproductive and unhappy within their role. And these difficulties can sometimes spill out, impacting on physical and mental health, people's mood and relationships, both in and outside of work. And burnout is something that tends to build up gradually, and there's estimates that about 18% of the workforce can experience burnout.
So what are the components of burnout? Burnout is a state of emotional, physical and mental exhaustion and or disengagement, which is caused by chronic stress, which can come on for a variety of sources. This can include, and most commonly, is the workplace. At the core of burnout is emotional exhaustion. So this is more than just tiredness, it's an overwhelming and persistent exhaustion that you experience on a mental, emotional and physical level. When you feel like this, engaging with work or any other life demands is very difficult. Alternatively, burnout can relate to feeling of disengagement, where your role becomes more of a process. You're just going through the motions, or you find yourself becoming more disconnected from the people you are trying to help.
And here are some examples with regard to that exhaustion and disengagement that Rebecca's talking about. During my work, I often feel emotionally drained. After work, I usually feel worn out and weary. I tend to think less at work and do my job almost mechanically, so that going through the motions. Over time, one can become disconnected from this type of work. And that work-related exhaustion can get stuck in place for a few reasons. So one of these can be stressful work environments. So where people are continually going into a really stressful work environment where the demands are much higher than the resources, people can begin to experience that exhaustion. Another reason it might become stuck is an inability to recharge. So people then tend to overwork, putting in more hours than they're paid to do, going in early, staying late to try and keep on top of that increasing workload. And that then eats into their own spare time. And often people are so exhausted that they haven't got the energy or the motivation to do the things they previously enjoyed, like meeting friends or doing exercise. And so they start to become depleted over time. And then another way that the exhaustion gets stuck is people develop unhelpful ways of coping. So things that they try to help can then become part of the problem. So staying up late to try and get a little bit of time for themselves, then meaning that they're more tired going into that busy day. Maybe a few glasses of wine to try and help unwind from a stressful day, then leaving them feeling a bit groggy the next day as they go back into work.
So unhelpful ways of coping that we have just discussed. If you were feeling emotionally exhausted, you might cope by becoming detached at work. So withdrawing from your colleagues or soothing yourself in other ways, like Lynne has just mentioned, such as using alcohol. Unfortunately, these coping strategies often lead to more problems. They can interfere with your performance and trigger worry and self-criticism. As your work-related stresses increase, so does your exhaustion. These strategies can also reduce your sense of accomplishment at work and getting in the way of your professional goals. When this does happen, you probably feel even more demoralised, fatigued, and unsure about your ability, which might lead to you using these strategies even more to try and cope. When your coping strategies become part of your problem, a vicious cycle then maintains your exhaustion and can develop like the diagram shown. You feel emotionally exhausted, so you cope by detaching, escaping or avoiding, and then you are more demoralised and ineffective, meaning the situation gets worse in and outside of work.
So that takes us on to theories of burnout. And there's quite a lot of research being done in this area now. And a lot of these theories relate to the simple idea of balance. So when our work becomes imbalanced, we're at greater risk of burnout. So that could be a balance between demands versus resources. For example, the number of clients or patients we see versus the time available. So if this becomes a regular occurrence that you're going into a clinic where you have much more patients than you've got time to see them, then that's going to put you at risk of burnout in the long term. Another way of looking at this is thinking about the effort versus the rewards. So for example, the number of hours you work versus the pay that you get, but also in terms of the satisfaction that we get from supporting others. So if you're putting in lots of effort, but you're not getting a sense that you're able to do the job in the way that you would like to because of pressures, then that can impact and make you more at risk of burnout.
And I think we are all very familiar with the straw that broke the camel's back. And with the pressures and demands we were experiencing pre-pandemic, COVID can be seen as that straw that broke the camel's back. We're already struggling with stress and burnout, and COVID has exacerbated the situation, creating more pressures and things to consider.
So we're now going to have a look at a model of burnout. So as you can see, the kind of broken lines around the circles of exhaustion and disengagement, these sort of characterise burnout as we've described. But then if you look at the green circles, what you can see are some protective factors for burnout. So self-efficacy, if you feel like you have got the skills and the resources to do your job and you feel good about the job that you're doing, even though it might be busy and pressured, then that protects you from burnout. Again, colleague support, feeling like you belong to the team, feeling like you've got support, that your colleagues share your values can be really helpful. Having autonomy in your role, so feeling like you have influence over your day-to-day work and that you feel valued and respected in that job. And again, job satisfaction, where you feel like you're putting a lot in, but you're getting a lot back from that as well. So they can all be protective. The other ones that you can see, the sort of pinky orange circles, those are the risk factors that have been identified in the research. So overcommitment, so working sort of above and beyond your day-to-day, feeling that responsibility to your team, that responsibility to the people that you look after. And that can lead to you overcommitting and agreeing to do maybe extra shifts or staying later or going in earlier to help out. But that in turn can lead to work and family conflict, which can then lead to arguments at home. And there also you can see a risk factor in workload. So we're so short-staffed, we're having to do twice as much. An example there of the work-family conflict, I'm always late home from work. That overcommitment where I can't let my colleagues. And again, these are where these protective factors have changed. So my role has changed so much that the person's sort of self-efficacy has changed. There's so many extra things to do. I don't feel I belong. I feel isolated at work. And we've all changed sort of the way that we work from the past again, which might have impacted on the team support that you had. Again, being micromanaged and people feeling they don't have time for the patient care that they want, or the job has changed significantly to what they signed up for. So again, it's worth just thinking about your own situation, just looking to see have you got some protective factors there? Have you got good colleague support? Do you feel that sense of satisfaction in terms of your day-to-day job? But then also maybe just thinking about some of those risk factors, if there's anything that's relevant that might be making you more at risk of burnout. And again, that organisational stress, and there's lots of pressures in different roles and staff shortages and targets, as we'll talk a little bit more about as we go on.
So let's now think a bit about burnout in the workplace. So we're going to look at the following areas: overcommitment, organisations and culture, and thinking about our roles.
So overcommitment, as we noted from the model of burnout, is a risk factor. And this is lunches for wimps, coined from the Michael Douglas Wall Street film. But this is something that has actually stuck, and it can be seen as a bit of a luxury to take a lunch break. And that's actually something that has to change, because it's a sign of something bigger, really, where people aren't able to stop and have a little bit of time. And I think it's something that goes on a lot where people are, under pressure. It doesn't feel like there is that time to stop. And these are some signs of overcommitment. I think, we're all guilty of from time to time, but it's just noticing if this is something that has become part of the norm rather than an exception. So not having a lunch break, regularly working over your contracted hours, not taking time back when it's available, finding that you're actually thinking about work problems when you're at home, or maybe taking actual work home and logging on in the evening. Another sign can be feeling that your partner doesn't understand how important your work is, getting into arguments with your partner about your work. And again, overcommitment can go unseen if both partners are overcommitted. And again, I think your team culture plays a big part as well. If nobody else has a lunch break, if everybody else stays later, then it's much harder to do some of those things that can be important for your own well-being. And I think that's where things need to change.
So the influences on overcommitment. They're both internal and external factors. So there may be attributes of ourselves that make us more likely to overcommit, such as perfectionism, where we need to get things just right, or not fully feeling skills, so we might feel the need to spend longer on a task. We may not be very good at letting go and wanting to complete the task ourselves, rather than handing them over at the end of the shift, or even delegating these tasks in the first place. Some of us can feel the weight of responsibility more than others, which stops us sharing this load with our team. We may have a hard working ethic, which may have come from our parents, brought us up, and the hours that they worked being what we're used to seeing. We can then see overcommitment as normal rather than something that has a negative impact on our well-being. We may also find that working hard and doing well gets us positive feedback, and so we feel better about ourselves if we are more prone to low self-esteem. Organisational factors such as high workloads and low resources, such as staff numbers, are common problems in healthcare and public sectors, which can force us to overcommit to be able to keep our service working. There may be cultural aspects of overcommitment also. So medical professionals where working extremely long hours is commonplace and often expected despite historic evaluation that this may not be safe for patients and staff. We also now live in an economically driven system, and it focuses on targets and numbers.
That takes us on to this next slide, which is just highlighting that idea that it's okay not to be okay. And again, I think culture ties into this too, depending on the colleagues that you work with, the team that you're in, can really influence whether it does feel okay not to be okay. There can be more pressure in certain teams to keep going and be okay regardless. But actually, given the pressures that everybody's under, what people have worked through, and also what people have in their personal lives, sometimes it does get too much, and it's important just to think about ways to look after yourself or to get the support that you need if that's the case. So part of that looking after ourselves, so most people working within the NHS, social care and emergency services are really good at looking after other people and find that, really easy to do and very compassionate and caring, but actually can find it quite difficult to look after themselves at times or to consider themselves important in that respect. So it's just thinking a little bit about some of that self-care and why that can be hard, if that is difficult, what are the barriers? For some people it's time, those work pressures make it hard to fit in, or again that emotional exhaustion takes away the energy or motivation to do some of the things that you maybe previously enjoyed in terms of being with other people or engaging in activities that we enjoy. And again, depending on the culture that you're in, that can just become part of the norm that you do neglect yourself and prioritise others. And these can be habits that are hard to break, but it's something that's really important to think about taking away from the workshop and how to try and change that for yourself.
So let's start by thinking of an example of when we've said yes to someone, when we've known that we're too busy or didn't feel able to do what they were asking. Could you have said no? How could you go about saying no or negotiating a result that left you less overwhelmed? Try saying no over the next week and write down how it made you feel and what the consequences were. There is no problem in saying no. This is something that can feel hard at first. But we must remember that it is okay to say no or negotiate a result that means you're not as overwhelmed. This might involve collaborating with colleagues about changing priorities of different tasks to acknowledge everything can't be done all at once.
And that brings us on to the role of organisation and culture within burnout. And something that we saw in that model was that autonomy can be a protective factor against burnout. And you can see these different boxes here, just looking at all the things that are important to make people feel trusted and valued, and not to feel micromanaged in terms of the job that they do day to day, to feel like they have some influence over that, can make a real difference in terms of people's job satisfaction and well-being in work.
So this slide shows the psychological safety accountability for performance framework. If we work in organisations where accountability is high, for example, the NHS, social care, emergency services, we also need the space and safety to speak up and to be heard. Otherwise, we exist in a state of anxiety with often high expectations and process around how a service is delivered. If we are unable to challenge this, to highlight problems or be creative and suggest ways of improvement, we are more likely to perform less well and even experience burnout. Feeling that we belong. We all like the feeling that we belong, that we are part of a larger family of colleagues. Here is a short video on why those feelings matter.
We do all kinds of things to fit in at work.
We socialise even when we have other commitments.
Pretend to be interested in subjects we don't care about.
Use language we don't usually use. Or gossip about our colleagues.
All because we want to belong. But what does that even mean?
We want to be accepted.
Listened to. Understood.
Recognised.
Trusted.
To be part of something bigger.
In it together.
To feel like my contribution really matters.
But even though nearly all of us believe that it's important to belong at work,
Because it makes us happier.
And healthier.
More motivated.
and productive,
Many of us
Don't feel truly accepted.
So what's preventing us from feeling like we belong? It can be due to office politics.
A non-inclusive work culture.
an unsupportive team.
Poor leadership.
a lack of training.
Or some other reason.
But
The good news is,
We can all do something about it. Because belonging is something that includes and involves.
all of us. So here's to the people who help us feel like we belong.
so thank you, Charlie, my career counsellor, for being so supportive when I took shared parental leave.
To my colleagues who understood and acknowledged my concerns around diversity at work.
To David, my colleague, thank you for bringing me a coffee when I needed it most.
To the advisory partners and associate partners who have helped me to develop my career and in so doing, making me feel like I truly belong.
Because it's not just about fitting in.
COVID has had a massive impact on how we feel we belong at work. We have started new roles during COVID and not met our teams in person. We are more likely to have significantly less contact with our teams. Opportunities that help team cohesion, as simple as things like taking a 5-minute catch up while making a cuppa, have been massively reduced.
And that team cohesion and those team dynamics are really important as well. And often there can be a sort of organisational hierarchy where it feels a bit more like them and us in terms of staff management. And that can often feel like sometimes that blame then filters down from the top. And we know that that's not the way to create a psychologically safe team, which benefits staff but ultimately benefits patients and clients as well. And this just kind of highlights the idea that, you know, in the last few years it's felt a little bit more like some people are more in the front line than others. So thinking about our roles, we know that the way that we think about our roles can influence our job satisfaction. And this is a short video which just looks at some research around this area.
The organization and then talking with the people who worked on the cleaning crew about what it was they did each day in their work and how they experienced it and how they felt about it, we found first a group of cleaners who talked about it in exactly the way that you would expect based on the research literature on this kind of job. They didn't talk about it as being particularly satisfying. They said it wasn't particularly high skilled. They talked about being there for the benefits of the work. And when they described what the tasks of the work involved, they described exactly what the job description of the organization listed. On the other hand, we talked with a group of cleaners who talked about the job in very different terms. They enjoyed the work. They found it deeply meaningful. They thought of the work as being very highly skilled. And when we asked them about the tasks and the relationships that comprised the work, they talked about completely different things than the first group. So this piqued our curiosity, and we started to wonder if there was a difference between the two groups with respect to the kinds of units they worked on, the shifts they worked on, who it was they were in contact with, and things like that, and could find no differences whatsoever between these two groups. In the second group, for example, in asking the cleaners about the kinds of things they were doing on the job, they described cleaning patient rooms each day and paying attention to which patients seemed to be upset, on the verge of tears, not having had many visitors that week, so that they could double back in the course of their shift to spend time with them, see if they'd like to have a conversation, give them an opportunity to cry. They talked about doing things like walking the elderly visitors of patients all the way back through the Byzantine structure of the hospital to their cars, which was an offense for which they could be fired, so that the visitors would not get lost, thus worrying the patient about whether their family members were okay. In perhaps the best known example from the work that we did, one of the members of the cleaning crew we talked with worked on a floor that cared for patients who were in comas and were hopefully coming out of those comas and beginning the long work toward rehabilitation and recovery. And in describing the tasks that were part of her job, she described taking down the pictures that hung in the hospital patients' rooms on a regular basis and moving them around, switching them around between rooms. And when we asked her why it was she did this, she said that her thought was perhaps something about changing some aspect in the environment of the patients, though they were unconscious, might spark recovery in some way. We became very intrigued by this and asked, is this part of your role, given that you work on this kind of floor? And what she told us was, that's not part of my job, but that's part of me. One of the things that was interesting in the study that we did is we asked every single cleaner we talked with, what is your role here in the organization? And those who worked in what I would classify as this first set would give us their technical job title that the university hospital used. But in the second group, we were more likely to hear things like, I'm an ambassador for the hospital, or in one case, I'm a healer. And when we asked the person, well, what is it exactly that you mean by this? She described, well, I create sterile spaces in which patients heal, but I also do everything that I can to facilitate that, whether it's caring for them, caring for their families.
So this just highlights that the way we view our job can impact on our overall well-being in work. So the shoe that didn't fit and progressive disengagement. So burnout is really something that happens overnight. It's usually something that has gradually been building over time, that disengagement and that emotional exhaustion. And it's that real difference between being in a busy, demanding job, but having enough time to do what needs to be done, so that you have got that work-life balance and time to do things that you enjoy and that re-energise you. Versus a busy and demanding job where you're chronically stressed, understaffed, there's too much to do, so you're working harder and having less time for those things that are important for your well-being outside of work.
So let's have a think about some strategies to support and what we can do. Directing compassion inwards and towards ourselves and towards others can help with our own well-being as well as how well we work as a team. Critical thoughts directed inwards and outwards prompt unhelpful emotional pause. Critical thoughts directed inwards and outwards promote unhelpful emotions which make the experience of our day-to-day lives and therefore work much harder. Treating ourselves the way we would a good friend is a form of self-compassion. For example, being understanding and supportive to ourselves, supporting our colleagues in a similar way, trying to understand and not judge can help reduce any difficult emotions that come from working with others, but also do the same across a whole team if we all put this into practice. When we focus on shared goals and values rather than differences, we can work better as a team. Acknowledging that we are all humans and that things not working out as we expected is a normal part of life can also help how we work together by improving team cohesion.
Another strategy that can be important is something called controlling the controllables. So as you'll see on the slide, there's different sections that look at things which we have no control over, things we have some control over, and then the things that we have most control over. And what can happen is that we can often spend a lot of time focusing on the ones that we have no control over, which is the natural way that our brain goes. We're trying to sort of problem solve, trying to get rid of any uncertainty. But where it's things out with our control, we can spend lots of time thinking about them, but we're not able to influence them. And that can make us feel more anxious because uncertainty makes us feel anxious. And it then takes away our focus from the things that we might have some influence over or the things that we've got most control over. So if you're feeling overwhelmed, it can be helpful just to put those different things that are on your mind into either no control, some control, or most control, and then think about the ones that you can influence. So that can be things like we can control how we spend our time outside of work, we can control the kind of things that we eat, whether we're drinking enough water, whether we're spending time with people that make us feel positive. So again, within the workplace, there can be lots of pressures day to day where we don't have that influence. So just kind of reflecting on your own situation and where these different circles might apply. And there is an example which is quite COVID focused, but it just helps to think about which ones have got most control, which have got some control, and which have got no control. Another strategy to support is a mindful minute. And this is something which can be introduced quite easily because it is a short exercise. And it's something that you might want to use at the start of your working day and then at the end of your working day to kind of bookend that shift. So what I'll do is I'll just kind of talk you through this mindful minute just to give you an idea of what it involves. I'm going to take 1 minute to scan your body and release any tension. So 1, begin by bringing your attention into your body. So noticing your back against the chair and noticing your feet on the floor. Just feel the weight of your body and push down through your feet. 2, connecting yourself with the floor in the present moment. So then just take some time to scan across your body and notice any tension. Just take a moment to loosen that tension and to relax and let your body be soft. And again, just repeat that as you scan across your body. Notice any other tension. Take a moment to loosen the tension and to relax and let your body be soft. 3, become aware of your whole body as best you can in this moment. So now shift your focus to your breathing. Just noticing as you breathe in and as you breathe out. Now take a few deep breaths. And begin to connect yourself with the rhythm of your breathing. So breathing in and breathing out. Breathing in and breathing out. And if you notice that your mind starts to wander, that's okay, that's what minds do. Just take that as a prompt to bring your attention back onto your breathing. And then just finish by bringing your attention back to the room. And this is just a short exercise that helps you to shift your attention and just bring you into the present moment, even for a short period of time. And it's something that you can use if you're feeling overwhelmed. It's also something that it's good to get into the habit of doing when you're feeling less overwhelmed. And the good thing about it is short, so it's more realistic than maybe setting out to do 20 minutes of meditation when you're already feeling really, really overwhelmed.
So the end of shift checklist helps to signal the end of a working day, and it starts focusing on the resources to then plan what to do and to have time off and pause.
That's good, I needed to cough.
The end of shift checklist helps to signal the end of a working day and to start focusing on the resources to then plan what to do to have time off, to soothe, to use up energy and to combat upset. So this could also include more time given to it, recognising positives within the day, with ourselves, others, and with the situation. Could also recognising strengths within ourselves, within others, and as a team or within a situation as per the earlier tools.
That brings us to the end of the Burnout workshop, so I hope you found it useful. We've got loads of resources on the website, lots of really helpful information, so definitely have a look there. And there is also information about your local staff support if you feel you would benefit from some one-to-one support.